AP Psychology, Childhood Schizophrenia by Jake Abel and Woody Walker.
Do it.
What is childhood schizophrenia? It's a severe brain disorder which affects the ways kids, teenagers, anyone under the age of 12 pretty much interpret what is happening around them. It affects people in the ways of thinking, cognitive, behaviors, and emotions. The results can be hallucinations, delusions, and disorganized thoughts. We'll talk a little bit more about that a little bit later. Profound impact can happen on a child's behavior because of childhood schizophrenia, and it requires a lifelong treatment. The youngest reported cases of childhood schizophrenia had an onset at the age of 3 years old and at the age of 5.7 years old. Childhood schizophrenia can be placed into three categories pretty much: childhood onset, adolescence onset, and early onset.
Splash. Push him over. Go down the slide. Splash him more. Run through the water. Swim underwater. Stop. Do it. Don't. Swim. Splash that kid. Put your goggles on. Splash. Go down the slide. Spray him with the bomb. Is that a squirt gun I see? No. Look at that dog. Stop.
Symptoms of childhood schizophrenia. Children will grow up with behavioral and emotional delayed stages such as language delays, late or unusual crawling, late walking, and a flat affect. Jake, can you show me an example of a language delay? Exactly. Most children will grow up with a lower IQ, mostly from the lack of interaction and abnormal motor behaviors. Jake, can you give me an example or tell me what abnormal motor behaviors are?
Oh yeah, sure thing, Woody. An abnormal motor behavior would be like just random movements, like moving your arms a lot, moving your feet a lot, moving your body a lot, your head, really any part of your body moving a lot. Is that what you think, Woody, right?
Lots of twitching.
Moving. It's hard to show because we're just talking right now, but
Ticks.
Lots of lots
Stuff
of
like that.
movement. Kinesthetic. Alright, childhood schizophrenia can also be considered teenage years. So like some teenage symptoms I'm going to list off now would be withdrawal from friends and family, a drop in performance, say at like school, test, and academic level, trouble sleeping at night or inability to sleep, irritability or a depressed mood, kind of just being down and out, lack of motivation. This is similar to a drop in performance, just kind of lower grades, not feeling like going to school, not feeling like doing anything you want to do in school, maybe strange or unusual behavior.
Sounds familiar.
Oh. And then one more thing, teens are less likely to have delusions, and they are more likely to have visual hallucinations. This is compared to adults with schizophrenia.
The difference for clarity between hallucinations and delusions is hallucinations involve seeing or hearing things that aren't actually present, while delusions are false beliefs that are not based on reality. Delusions are more towards the paranoid side of schizophrenia, while hallucinations are more towards the visual and I see that, I hear that, I know that, I think that's going on type of schizophrenia.
Do it. Don't do it. Stop. Do it. Stop. Don't do it. Do it. Go.
No.
Do it.
Some more signs and symptoms. Disorganized thinking and speech is impaired thinking or speech that does not make sense. It could be like unrelated answers to a question, just blabbering out meaningless words, saying words that don't make sense, or using an incorrect grammar or order of words.
such as many serial killers when on the stands, like Charles Manson, will sound very intelligent, but are really just blabbering on with absolutely no meaning or depth to their speech.
Yep. Also, abnormal motor behavior. These are behaviors that are not focused, making it more difficult to stay focused on a task that you're doing. So say you're doing a simple task on the work job, like filing papers, it'd be a lot harder if you have schizophrenia to stay focused doing this task. Also, they can also consist of random movements, like I said before, bizarre posture, and useless movements.
Back to the symptoms of childhood schizophrenia. Many children, like we have said, have developmental delays compared to other siblings and peers, so it may take them up to twice as long to start talking, to start critically thinking, to go into the different stages of mental and emotional development. Many have stopped meeting daily expectations such as chores, bathing, dressing, eating, just doing the normal things that you have to do to survive, which is why many have to be under constant and intense surveillance by parents and or doctors. Many kids with schizophrenia no longer want to socialize, which you have to try to get the difference between never wanting to play with a kid and just being kind of antisocial. A big thing in childhood schizophrenia is when they do start school, the slip in academic performance. So as their phases of schizophrenia get stronger and come on, they will slowly dip and drop their grades in school. They will no longer really care, which sounds like many kids in high school, but when you really think about it, if you were an A student and then went just straight down to a C to D student, you would really think something was going on. Back to the paranoia, many children will show excessive suspicion of others. They think maybe their parents and or doctors or therapists are out to get them or are out to not help them, and that's usually due to voices in their head that are telling them this. They have strange eating habits, which many kids do, which once again is you have to try to find the line between a child and then a child with schizophrenia. And then the lack of emotion would be a very big thing to look for when trying to find childhood schizophrenia. The lack of emotion or shows emotion inappropriate for the situation. Back to what adults have, many adult symptoms and children's symptoms kind of overlap, as in strange ideas and fears or violent or aggressive behaviors. Many of those are why they have to be institutionalized, because they are going to be a danger to themselves or others. If childhood schizophrenia is not caught and diagnosed before the teen or even the adult years, you could have untreated results that could last a lifetime. Many of those would be poor performance or inability to attend school or work, the inability to perform daily activities such as bathing or dressing, which is much like the symptoms of childhood schizophrenia, where you just don't go about your daily routine and you aren't able to take care of yourself. Many of the results are much like the symptoms, which would make sense because if you don't catch the symptoms are just going to keep going. The withdrawal from friends and family, suicide, self-injury, anxiety, and phobias are all very big in adult schizophrenia. Schizophrenics have a very high rate of suicide. And then the phobias and anxiety, many of them believe that something is out to get them. They are afraid of certain things such as government and institutions like that. And that phobia would cause anxiety when they think, say someone is a schizophrenic and is afraid of the government and people taking control, which is a very common phobia in schizophrenics. That would cause them anxiety because they are always under constant government control and regulation.
Recycle that. Don't. Stop. Just throw it away. Take the recycling out. No, put it in the landfill. It's Tuesday. Garbage. I like to litter. Recycle it. Do it. Don't. Do it. Recycling. Mr. Peterson.
Most schizophrenics unfortunately move towards depression, alcohol abuse, and drug abuse, poverty, and homelessness. Many homeless people, as it is sad to say, have either mild to medium case of schizophrenia, where many of them just don't understand that what they have going on is a problem, and they just think that they are either like special or different from everyone else. As they go on to try to get rid of the symptoms like the talking and the things that they see, they turn to drug use. So when they take a drug, they get things that aren't supposed to be there, but they know that they put those things there. And it kind of takes them away from their world of talking and hallucinations. It kind of takes them away for a little while. The same is with alcohol abuse. They just they get to be in charge of them seeing/hearing things that aren't really there. Many schizophrenics have to be institutionalized if they are medium to high risk case. Medium for a certain amount of times when a wave of symptoms come back, and high problem cases are always institutionalized because they have the inability to live independently. Since they can't take care of themselves and they can't keep a normal daily routine, they can't brush themselves, bathe themselves, brush their teeth, eat regularly. They have funny eating habits, so they may just go days without eating, which would lead to health problems.
Alright, this concludes our informational portion of the project. Thanks for listening.
Do it. Do it. Oh, stop.